The first time that I was diagnosed with ovarian cancer, I was 41 years old. What's really interesting about my diagnosis is that I didn't have any symptoms at all. So for ovarian cancer, there is sometimes things that you feel that are happening, but none of that was happening to me. The way that I discovered it, which was really interesting, was working out. I was doing a press over my head and I felt something snap on my neck. Through a series of scans is when it was discovered that I had lymphoma, to later get a biopsy on my neck that uncovered that it was ovarian cancer, much to my surprise.
There's no screening for ovarian cancer, so oftentimes when we identify a patient with ovarian cancer, we identify them at an advanced stage. So 85% of women diagnosed with ovarian cancer are diagnosed at stage 3 or 4. So patients like Erika who at advanced stage will get a combination of chemotherapy. And additionally, we now have PARP inhibitors that we use during maintenance to really improve the outcomes for these patients.
What I had to do first as a person was get right with what was happening to me. I have a daughter who at the time was 7 years old. As a parent, you begin really thinking about all the things that you may miss. So prayed a lot, did a lot of what I had to do to begin believing that I was gonna live, because with a stage 4 diagnosis, it doesn't look too good for most people.
She did great with her chemotherapy. She was always in a good mood and was very positive, and it was a pleasure to see her. And she's done very well.
With Dr. Diaz at Miami Cancer Institute, I had laparoscopic surgery where they removed a couple of tumors. And I also had a procedure on my neck where they removed those lymph nodes that kept on being problematic. And I was able to walk out of that surgery with just being able to have mobility, move around, but I really felt safe and I felt taken care of. And there was always a smile and there was always somebody to really comfort me through that period of time.
It's been great to work with her, not only as a physician-patient relationship, but as our friendship has grown, and I look forward to working with her in our community to help spread the word about ovarian cancer.
There was like some dreams and things that I put on hold, but I think that every day I remind myself, I'm still here, I'm just gonna go do it.